Well, good morning, Rotary District 7770. Welcome to Conversations with Rotary Action People for Friday, May 29th. My name is Donald Hovis from the Chicora Rotary Club here in Myrtle Beach, South Carolina. Today's topic is all about how has COVID-19 affected our polio eradication efforts. And our special guest today, you know him. I was hoping he had the purple wig on today, but maybe that'll make an appearance before the end here. Past district governor of our Rotary district and our End Polio Now chair, Mr. Bernie Riedel. Good morning, Bernie.
Morning, everybody. Morning.
I thank you all for being on the Zoom call today, and we're also streaming this over on our Rotary International District 7770 Facebook page. Those of you on Zoom, please go to the chat box, tell us where you're watching from and your Rotary Club. Also, those watching on Facebook, please post a comment below where you're watching from and your Rotary Club. Bernie, I want to start off today with the vision statement of Rotary. Together, we see a world where people unite and take action to create lasting change across the globe, in our communities, and in ourselves. I will introduce a few key people on the line today. Past district governor from the Rotary Club of Hilton Head Island, Mr. David Terrard and his wife, Susan. I see district governor-elect from the Rotary Club of Myrtle Beach, Miss Pauline Levesque. Good morning, Pauline. And also on the line, our public image chair for our district from the 5 Points Rotary Club in Columbia, Miss Mary Gask. Good morning, Mary. And our district communications chair from the Rotary Club of Somerville Evening in Somerville, Mr. Terry Moore. Good morning, Terry. So Bernie, we're excited to hear from you to give us a polio update and how maybe COVID-19 has affected those efforts. How about take it away?
Okay. Let's see. Well, let me start this way. Now, I'm not a doctor. I think most of you know I'm not a doctor. I don't see, Huff, you're a doctor, but maybe not the right that I'm talking about. But if there's a doctor out there, I'm gonna start by comparing polio to COVID-19. If I say something wrong, please unmute and correct me, but I'm going to do my best. So first of all, let's look at polio and COVID-19. I think we're all familiar by now. COVID-19 is likely primarily an airborne virus. You get it coughing, sneezing, that's all bad. You don't want to be around somebody that's throwing out those droplets and you're on the other end of those. So, you know, we got the mask and okay. So it's an airborne virus primarily, and it affects the elderly and those with underlying health conditions, especially respiratory conditions. And they're the most susceptible to the COVID-19. And as we speak, I think we all know that there's no vaccine. Doesn't exist yet. So now let's look at polio. Now, I have to be a little graphic here. So polio spreads person to person via infected fecal matter entering the mouth, usually in food or water. And this is usually the result of very poor sanitary conditions. And it mainly affects children under 5 years old. And of course, we know the vaccine does exist. So it was interesting, though. So there's obviously, you compare the two, they're very different. But we were on a Zoom call this morning, and Dr. Carol Pandick from the Rotary Foundation, she's director of Polio Plus at our Rotary Foundation. And she was one of two speakers. And the topic was exactly what we're talking about here, COVID-19 and what's it doing to our polio efforts. And she brought up an interesting point when comparing COVID-19 and polio. And you have to go back, and I think some of you out there, me included, you have to go back to when polio was going around the United States And we didn't have a vaccine yet. Can anybody out there remember that? No vaccine, and polio is a threat to all of these children and they're coming up very paralyzed. I remember the isolation. I remember, if you will, staying in place or sheltering in place. They didn't call it that then. I remember pools being closed. So because the water would spread the virus. And she said, that's where we are today with COVID-19. And if you think about it, it's very, very similar. So, so that's all I wanted to say about comparing the two viruses. Now, okay, so now the question is, how is this COVID-19 affecting what we're doing in polio eradication? Well, in order to understand that, you have to understand what we're currently doing, or what we had been doing for polio eradication, and then we'll talk about what's changing. So I need to just set some fundamentals and give you some scope kind of things right now. So bear with me. It's going to take a little detail, but bear with me. There is this organization called the Global Polio Eradication Initiative. They call it GPEI. And it consists of, it used to be 5 organizations. It's now 6. I found that out recently. So, and those organizations are the World Health Organization, UNICEF, CDC, the Gates Foundation, of course, Rotary. And just recently they added an organization called Gavi, G-A-V-I, who basically is into vaccines, and they provide vaccines to very poor countries. So there's now 6 organizations now. And what the GPEI does is, for years and years and years now, basically since 1988, they have set the plan in motion. They're the ones controlling where we go, what countries, working out the details. So they're the overriding organization that guides all of this. Right now we have programs. They are responsible for programs in just about 40 countries. These are pretty much developing countries. And they have active programs that they're monitoring and doing in 40 countries. So that's what we're talking about when we get to talking about resources going to COVID-19. We're talking those countries and what the GPEI does. We're not talking about anything that has to do with, like, the United States, where we have existing countries that already have vaccination programs, and children, and they're born and they get vaccinated. All those programs that are in countries like that is not affected by anything the GPEI is doing. So for the purpose of this conversation, we're just talking about those countries that GPEI is affecting. So we have now 35 years. It's hard to believe, but we have 35 years developing this surveillance, this detection, this prevention system that we're currently using for polio. A couple components of it. The first component I want to talk about is there's 2 surveillance programs. One is environmental surveillance, and this is where teams of trained health workers actually go and do soil, water, and sewage samples in these countries. And they take that information back to the labs for analysis. And they've been doing this for years and years and years. So we have developed quite an amazing database of this stuff. So when they do that, they can compare what was there maybe 6 months ago, 3 months ago, to what it is now. And the real benefit of that is they can identify pretty early on potential hotspots. So when they look at these soil analysis or water analysis, they can say, well, this is really junked. And that might be in Nigeria, or it might be in Ghana or someplace. They can say, this is a potential hotspot. And they can quickly send teams out there to verify and see if it is spreading to actually children. And that brings me to the second surveillance, the second part of that. And this surveillance is actually the paralysis part, where teams go and they find children that are suffering from acute flaccid paralysis. Now they call it AFP. I'm not a doctor, so acute flaccid paralysis. So they can see when children are dealing with this paralysis. And these teams, when they go to villages or communities, they really go to hospitals. They talk with community leaders to try and get some insight into if there's some kind of sickness going around that people are talking about. And they actually go around and just talk to ordinary people to see if they can get a follow-up on this kind of stuff. If they find somebody that is suffering from paralysis, it's pretty nice. There's an app for that. So they get their smartphone out, they go into the app, and they start putting in information about the child, and it immediately gets sent back to the lab. So that's good. That saves a lot of time in what used to be a procedure they'd have to wait till he got back. So now they can do that via the app. While they're there with the child, they actually take a stool sample, and they take that and they take it back to the lab for analysis. Now, this has become, it's really like DNA. I mean, it's become that good. First of all, they have to isolate and see if it really is the virus, if it's really the polio virus. Once they've done that, then they can, this is incredible. They can identify exactly where that virus came from and the strain of virus it is. So, for example, somebody from Pakistan could be traveling into Nigeria, and that's when they actually contract and show the paralysis. They would be able to tell that person was actually infected in Pakistan. I mean, that's pretty amazing stuff. Okay, so surveillance, we have the physical part, and then we have the part, the environmental part, and then we have the part where we actually look for the children. Another part of what we do today is when we send teams out is the prevention part. And I think we all know about, the vaccinations that we do, but part of that, when they go out to do prevention, those teams educate. And it's basic stuff. Of course, we know it's the water. Water is very dangerous. That's how it spreads. So they get into washing hands, boiling water, generally trying to improve the sanitary conditions that the families have. So boiling water, for example, is something they do to try and make sure the water is clean. We're fortunate here in our district. We have a fella in our Rotary Club, Brian Julius, who developed something called speaking books. And to date, his speaking books have gone in Afghanistan, Pakistan, and Nigeria. And I'm talking thousands and thousands of these books. And they're polio books. And a good part of what he does in the speaking books, and these are books that you literally, they're for children and families, and when you turn the page, it speaks to you. You hit a button, and it speaks in their language. So it's a good way of educating families where they don't get a lot of support from these the medical staff and the teams that come there. So it's had a very big impact. But that's part of the prevention program is education. Of course, we do the door-to-door vaccinations. We do the national immunization days. They have a supply of vaccine. There's have to be proper storage to keep the vaccine because you need cold storage for the vaccine. We're talking the oral vaccine. And of course, you have to have transportation. You have to have volunteers. You have to have all this in place in order to do that. We also have emergency response teams. Remember, I talked about hotspots when they, and that can be either by soil samples we see that, or we can see the actual outbreak where children are being paralyzed. They send these emergency response teams to the hotspots, and so we keep track of all that. All this stuff we're talking about is entered in this huge database system, which is part of what we all do. Give you an idea on the immunizations. Carol Pandick this morning said that last year we vaccinated 400 million children in the world last year. Think about that. Now this process that I've just gone over all is responsible for those 400 million children being vaccinated. It's quite amazing. Okay, so in order to do all of this, we have to have assets. So you don't think of it, but there's offices. I mean, regular business offices. We have office supplies. We have communications, phones, computers. We have these labs. Do you know these labs that do the analysis and all? There's 146 of these labs throughout those countries. We have vehicles. We have cold storage. We have volunteers. We have health professionals. We even have paid personnel. Now, everything I just talked about, I know it's quite a bit. I have a tendency to talk too much. But I thought it was important because everything that I just talked about is what we do. And it's what we call the infrastructure. So when you hear people talk about COVID-19 and we're taking our infrastructure and moving it from polio to COVID-19, this is what we're talking about. Now, there are some caveats here. I don't want to get into it quite yet. I'm going to talk a little bit about it in a little bit. But when talking about COVID-19 and the impact, you have to understand that this whole system that I just talked about is used for many, many other things. I think some of you will remember the Ebola epidemic that was in Nigeria. This was back, I had to look it up. This was back in 2014 when that broke out. It's hard to believe, 6 years ago, but that's when that broke out. It was in Nigeria and people were dying. It was bad. Do you know that they used the polio infrastructure for rapid response and tracing the disease, for ongoing monitoring and rapid isolation? And as a result of doing that, you may not, I didn't know this. Like I said, I had to look it up. That epidemic, that Ebola epidemic, was over in 2 months because they had isolated it so quickly and dealt with it. So that's one example. There's others. Yellow fever. Yellow fever is another one that has used it, and that was 2017 in Africa, Central America, and South America. SARS, avian flu. That's just to mention a few. So the system has been used quite a bit for other diseases other than polio, and we're just seeing it today with the COVID-19. I guess. Okay, let's talk about COVID-19 now. So now that we understand what we do, here's how the GPEI is responding to COVID-19. They're deploying coordination mechanisms such as the emergency operations centers, the sharing of physical assets that we talked about, vehicles, computers, mobile phones. All those assets are being reassigned to combat the pandemic. In Nigeria, for example, there's an extensive network of polio communication assets, including, get this now, this is in Nigeria, 20,000 volunteer community mobilizers are working to spread the news, to promote distancing, hand washing, even providing soap to reduce the transmission of this disease. Pretty much they're going out and telling the people the same thing, the guidelines that we've been getting. But they have a team of 20,000 people going out to do that. That's in Nigeria. Pakistan. The polio staff have trained more than 6,000 health workers on COVID-19 prevention, isolation, treatment, and repurposed a huge helpline where people can call in and say they have a problem and dispatch what's needed. That's in Pakistan. Polio surveillance team in Angola is training healthcare professionals how to handle different cases of COVID-19. This is all being done by the polio staff, the people that are been out there working the countries. So how is all of that affecting polio? Well, we pushed all our resources to COVID-19 except the surveillance part. The GPEI said surveillance is extremely important. We don't want to tamper with that. We need to know where the cases are, where the outbreaks are, because we are still going to treat hotspots when they pop up. We're still going to go out there and send teams to vaccinate. So that's still going to happen. So we did not give up the surveillance part. Now, there is surveillance going on for COVID-19 also. And I just heard in the past couple of days that the GPEI is concerned because some of the surveillance has slipped. So they're reconstituting the efforts and trying to make clear that we really need to keep up these surveillance efforts. That was part of it going in. But of course, they're using it for COVID-19 too. So they're just going to have to man up and try to keep it up. We've given up entirely. We've stopped house-to-house vaccinations entirely. We don't have the resources, and it's a safety concern. We don't need our people going out and interacting with people, and maybe even getting COVID-19. So they've stopped house-to-house vaccinations entirely. People ask, well, when are we going to resume polio immunizations? When are we going to start our campaigns again? Kind of the general feeling is when it's safe to do so. I know that's very general, but nobody really knows. You ask them exactly, they don't know when. You get something back like when it's safe or possibly this fall. So we have to go by now. Is it hurting? Is it hurting us in our polio efforts? Yes. We're not able to respond, obviously, as quickly. And the vaccine is not, we're not being able to vaccinate people the way we were. So you're going to see an uptick. Pakistan, Afghanistan, you're going to see an uptick. You're just going to see it. Some good news. There is I'm going to talk about this a little more, but a little later. But there is a new oral vaccine that they are developing, and it's very, very close to being rolled out. And I'm going to tell you the importance of that in just a little bit. Donald, are you there?
I am here.
You just asked one question.
Yeah, because I knew how much you were prepared. You've gone right down the outline here. Amazing.
That was the point. Now, but I mean, are there any other questions that you want to ask me, or?
I do want to mention one thing, and those of you that have been on the Facebook feed may notice we have 3 visitors, and I would like to at least announce where they're from. Bernie, people know you around the world, and when I tell you where these people are from, that makes it come to fruition. We have someone watching from District 3182 in India.
No. India.
Someone watching from District 4480 in Brazil. And also District 6990 in Weston, Florida.
Can they understand what I'm saying?
They've been on the whole time. So I guess so.
I guess.
And we're getting a lot of questions to come through the chat box too. So did you want me to go to those now, or? No. I have more to cover. I just didn't know if you wanted to, like you did. You've stopped and interjected some stuff, but I'll ask myself the question. How's that? Well, the next one I had up on my list was, will Rotary's polio money still go to fighting polio?
There you go. That's the one I wanted you to ask me. Okay. So I get hit with that all the time too. So it's not just what happens when we swap over to COVID-19, but then they say the next follow-up question is, okay, all the money that Rotarians are giving to polio, is it still going to fight polio? Well, yes and no. Not all of it. Not all of it. Now, let me see if I can explain. So now that you know kind of the infrastructure, you know what's going on, a lot of stuff going on. So when they switch over to COVID-19 and we have these health professionals, some of them paid professionals, so their salary is going to continue to get paid, and some of that is going to probably come out of some of the polio dollars. We have transportation. We have to maintain that. We have to gas and expenses and things like those kind of things that take place for COVID-19 are that polio that Rotary has paid for Rotary will continue to pay for. Now, when I dug down deep and I found this out, I was taken at first. I'll be honest. When they said that, so you're telling me all this money that we're collecting, really not all of it's going to polio? And the answer is no, not all of it. Obviously, most of it. But the response then was, but it's going to help stop the spread of COVID-19. So the word they use, and this is coming from people way above my pay grade, the words they use is, it is our moral imperative to help prevent COVID-19. And they don't view this as lasting, long term. Hopefully a couple more months that we can do this. But to just be upfront, that's not a bad thing when you think about it. Okay, so it's not all totally going to eradicate polio. You kind of knew that when we were saying about all these resources going to COVID-19. But it's still a good thing. When we talk about some of the other things, some of the polio money probably went to some of those other diseases that we stopped. And that's, if you just stop and think a minute, that's all a good thing. So I can't give you a percentage. I don't know what it is. I don't think it's a large percentage. It's but it's to keep all that stuff going that we talked about before. So I hope did that answer your question, Donald? I hope.
Yes, sir.
Okay.
So can you tell us, is there a new vaccine coming?
I'm glad you asked. Yes. Now, the vaccine we're talking about, of course, the one that Rotary uses primarily is an oral vaccine. And that vaccine contains the live polio virus. And a problem that we've had is that virus is not genetically stable. And what I mean by that is a child can get that vaccine and it can mutate. It goes into the child's intestines, it mutates, the child expels it, and it gets into the system and gets into the water supply, and here we go. And it starts infecting other children. That's when you've heard the term circulating vaccine-derived polio. And that's what we're talking about when we say circulating vaccine-derived polio. It actually comes from the vaccine, it mutates, and then starts infecting other children. And there's been a number of outbreaks. Last year was not a good year for circulating vaccine-derived polio. There were like 368 cases in 19. And these are people, children are being crippled by this. I mean, it's the actual polio virus. So we always report the number on the wild polio virus infections, and that's important. Last year there were 122. We hardly ever talk about the circulating vaccine-derived, and that was 368. Kids being infected, kids being paralyzed. So most of that 368 was in Africa, Chad, Congo, Ethiopia, Somalia. Most of it was in Africa. Not all of it. Some was in the Philippines. Some was in even China. Number of small cases. But most of it in Africa. So to solve that problem, there is an injectable. There is the Salk vaccine, which is an injectable. It's a dead virus that they inject via a needle into people. It's more expensive. You need medical staff to do it. It's not meant to do mass vaccinations, but it's safe. The injectable is safe. You're not going to get other people being infected because of that. Only with the oral vaccine, which is the live vaccine. So here's what's exciting about the new vaccine. The new vaccine it's going to take the place, it's going to be an oral vaccine. It's worked on everybody that they've tried it on. So that's good. That's very good. In the test phase, it's very good. But this new vaccine is genetically stable. That's huge, because now you're not going to have it mutate. It's not going to mutate in the intestine. It's not going to be able to spread to other kids. So that's huge. They expect that to roll out in the second half of this year. In fact, there's even some people that think we might even get that to start hitting the streets maybe in July or August of this year, and that would be phenomenal. You would see this circulating vaccine number, the circulating vaccine derived drop, and that's they know that. That's why they've gone ahead and put the effort into coming up with this new vaccine. So everybody keep your hopes up that this thing goes live and it's as effective as it is in the test phases anyway. So that could be huge. Just as a little history, just last year we had 61 wild polio. I'm sorry, this year so far, 61 wild polio cases this year, 12 in Afghanistan, 49 in Pakistan, versus 176 total last year. Now, it's the wild polio virus I'm talking about, not the other one. So, okay, I'm getting tired. Donald, do you have any more questions?
Take a breath, Bernie. Take a breath.
Yep. Tired.
I love how you put all your energy and passion into everything that you do anytime you speak. So take a little breath.
I need to get a drink.
There you go. Absolutely. I did also want to mention we do have a special guest on the Facebook feed. Rotary Regional Foundation Coordinator for our zone, Nancy Barbie, is on. So thank you, Nancy, for being here.
Hey, Nancy. She's my boss. She's my boss, by the way.
Well, she knew to tune in to a legend here today. So, let's see. This is a comment. This came from a viewer here on Zoom. I was in elementary school. A boy who lived next door to my family contracted polio. This is also a comment. Remember, town pools and swimming pools are closed. 2 of my classmates in high school were survivors with disabilities. This is a question. It's more of a comment and then a question. We, the USA, have had the vaccine and been polio-free for many years. Do we have any information on the negative effects of the anti-vaxxers?
Oh, that's probably above my pay grade. I'm not sure I want to weigh into that because I really don't have specific knowledge of that. I can just tell you that we haven't had a case in the United States since '79, at least that I'm aware of. I mean, the vaccine came out in, let's see, the Salk vaccine came out publicly in '55, and I think the Sabin, the oral vaccine, came out in, I think, '56. And in '70, it took a few years, but in 1979, the United States was declared polio-free. So, honestly, I don't know. I can't answer the question.
All right, the next one. Because of the education of doing a simple thing like washing hands, should polio cases drop?
Yeah, I don't think just washing hands is going to do it. It's the sanitary conditions that have to be changed, and we're talking about clean water basically in these areas. So when you go into a village and they see the open sewerage and kids taking baths in dirty water and drinking dirty water, I mean, it's prime for the transmission of polio. So when you see these grants, these Rotary grants for putting in wells, clean water projects, this will all help to eliminate the transmission of polio, along with going in and educating these people. But certainly the primary thing is to vaccinate, get people vaccinated and then try to get the sanitary conditions in these villages, up to a better standard.
And I will say, if you guys do have any questions for Bernie.
Can I ask a question?
Yes, you can.
John, you can.
It's John Cunningham.
I know.
I think you said that the only countries where it is at the moment are Pakistan and Afghanistan. I think that's where you said. what do they represent in terms of, say, the percentage of vaccinations? And are the vaccinations in those countries being increased to try to eliminate the incidence of polio there, relative to the other countries that where vaccinations, I assume, are still going on?
Yeah, you remember I told you under the GPEI. Now we're talking GPEI. There are countries that have standard regular vaccination programs like the United States. So we're not talking about that. We're talking about the countries, the 40 that I mentioned, the 40 countries that are under control of the GPEI. Well, obviously Pakistan has gotten a lot of attention, and a lot of vaccinations are going on in Pakistan. I did say there's 400 million they did last year. I don't know the percentage. Take a country like India. I don't know the billions of people that are in India, but there's babies. Nancy Barbie could probably give me a number on that because she's done so many NIDs to India. But children are every year, millions of children are born in India, to give an example. So those children have to be vaccinated. We have to continue to vaccinate those children. So we're talking millions in India. Those kind of ongoing things happening all the time in these countries. And we really literally can't stop because it could rear its head again. But your question to me was percentage wise, Afghanistan and Pakistan get the attention because they're the only two countries where the wild polio virus is still endemic. It's still natural to those two countries. We didn't talk about Nigeria, but Nigeria is on the cusp of becoming declared polio free. Hopefully, I just heard today in our Zoom call this morning that August, they will probably be declared polio free. And that will be the entire continent of Africa declared polio free from the wild polio virus. So, but that certainly does not mean that vaccination programs are not going to continue to take place in Nigeria and all the countries in Africa. But I'm sorry, I don't know the percentage. I would think a percentage based on like India with their population, I would think that's a pretty high percentage in India. Nancy Barbie, can you speak to that?
She's on the Facebook feed. I will say, guys, if you do have questions, we ask that you post those in the chat box. Please do not come off mute for those questions, please. Thank you for being on this morning. We appreciate it. Got a comment here from a viewer. We can be proud that our years of improving polio eradications are the tools being used to provide a quick response to COVID-19. Rotary connects the world.
Exactly.
Nancy Barbie just posted on the Facebook feed 1.5 million births on a monthly basis in India.
She said on a monthly basis?
That's what it says.
Well, what is that? That's 18 million a year. 18 million a year. About.
That's a lot.
That's a lot. That's all. And that's a continuing vaccination program that has to happen for all those babies, newborns. So.
Yep. I think this will be our final question for today, unless anyone else has another one here real quick. What does World Polio Day look like this year?
Mary Gask. Mary has given up leadership on that, so we have another person working on that, but I honestly don't know. October is polio month, so it's a big fundraising month for our district is October. I haven't checked officially on World Polio Day, from RI and Foundation. I suspect they're still going to have it, but it's going to have to be major cutback. I know there's so many people concerned about getting together, and I think the official stance on Pauline, you may be able to help me here. The official stance is I think the rest of this year, I think RI people, Foundation people are told no face-to-face talking for the rest of the year. Is that correct, Pauline?
And Bernie.
Yeah.
Yes, it is. Oh, I'm sorry. Virtual. just like our convention in June coming up is going to be virtual. That'll still be recognized. It'll still be celebrated, but it will be virtual, everything until the end of this year for Rotary International. Doesn't mean ours will. Mary wants to say something, but
Yeah, I was just going to say, I was going to jump on what you were saying, Pauline, is that we were thinking about still doing the World Polio Day, but making it a virtual day and still having speakers that we broadcast things that they say, and it'll be virtual. As Pauline said, everything's virtual now. So I can't imagine having a large gathering and have people show up. And which is a shame because it's a Saturday this year and that would be a fabulous time to have it. But we will adjust and do what we have to do. So Pauline's correct. Thanks.
Well, thank you again, Bernie. Amazing job. Great job. Really do appreciate it.
Welcome. Oh, last thing. Whoever's on right now, I just need to thank everybody in our district, all the Rotarians in our district, for their amazing support for polio. I mean, we're knocking the numbers off. We've never had, in our district, we've never had polio numbers like this year. So it's been an amazing year. Everybody's reached out and gone over and above. We've exceeded our goal. We've gone well over $1 million in total impact this year fighting polio, and we've never done that in our district before. So I just want to thank everybody so much for in their continued support. So we got a month left. We got a month left in the year. So let's not quit. That's it. Let's not quit.
And last thing, Nancy Barbie here has posted another little quick update. Mary, I want you to take a note of this. I can also, Nancy, if you can email it over to myself and Mary. I think you still have our information from when you were on this segment about a month ago or so. She says to put on your calendars July 29th, when District 7730 will host a NID celebration to kick off polio fundraising. And they will have Dr. Matthew Varghese on the call from India. He has been in the Rotarian magazine several times as the only remaining polio award for corrective surgeries in India. So she said it will be announced soon in a Zoom meeting link to come. So thank you for that information. That should be amazing. I will say we do these segments, folks, on Monday, Wednesdays, and Fridays at 11 a.m. And our guest on Monday is on the call right now. David Powell from the Somerville Rotary Club will be talking about Blessing Box on Monday at 11 o'clock. So please tune in for that. Bernie, thank you again so much. In closing, I'll recite the Rotary four-way test of the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? That's a wrap for Conversations with Rotary Action People for Friday, May 29th. See everyone on Monday. Hope you have a wonderful weekend. Thanks for tuning in.